celebrating the baby boomer lifestyle. This is Boomer Life with Sterling Fox on AM 650.
Welcome back to the program as we welcome back to the airwaves of AM 650, Dr. Ron Zokol. Our expert in dental solutions is back, friends. Dr. Zokol is a reconstruction and implant dental expert, and that's just the beginning. He's a pretty accomplished practitioner, who, along with his colleague, Dr. Bobby Birdie, is just about to launch a new project called BC Perio, and you can check them out right now at BC Perio, P-E-R-I-O, bcperio.ca. This is now, are the offices open, or are the website's up and running? Are you just teasing us here and getting our interest keened up because it's coming soon?
Well, yes, and BC Perio is up and running.
Yes.
And this right now is a group of 4 periodontists, Dr. Birdie being the owner of the facility, and the person who I'll be working with for the rest of my career. We're in the practice of doing that transition right now, and we are working together, collaborating, and he's become a partner in my institute, the Pacific Implant Institute, as well.
Right. Now, you are the founder of the Pacific Implant Institute. You've been on the front edge of this new dental technology for a long time. And now it's starting to expand. More and more dental practitioners are offering implants as an option to their patients. I would think, though, because it is such a new and evolving technology, Dr. Ron, that you have, especially in the earlier days, been called upon to, address problems that were perhaps not done properly in the first place.
Yes, unfortunately. And let me preface this by saying that I believe that fundamental implants, simple implant systems, should be placed by the average dentist. They should have the knowledge and training to do that.
Okay.
However, you're quite right. It's very unfortunate. I'm unhappy to report that I have seen about a 400% increase in the number of referrals that I've had to treat mispositioned implants or poor results from implant treatment, and that I find is very an unfortunate statistic.
Right.
And I think part of our responsibility is help train doctors to recognize when it's appropriate to refer cases and when it's appropriate to treat them yourself. And I think there's a good solid distinction there, and we've unfortunately had to treat too many that need what we call revision surgeries.
Right, and again, that I suppose is part and parcel of any new technology, though, isn't it? There's a sort of a trial and error phase. Science is not perfect and never has been.
No, and when you think about it, a dentist is trained to do fillings and crowns and things like that.
Sure.
But there's levels of complexity with each of those, and so is the same with implant dentistry. The unfortunate thing is even more complex, and therefore the proper case selection is based on your understanding what the knowledge base is for the deteriorating system, not just a single tooth. There's a lot of factors that go into it, and what we have to train the field of dentists in the general concept of dentistry is we have to train people to start to understand the big picture and perhaps when implants are done and how to do them more effectively and predictably.
Okay. I like to take a moment every chance I get hosting Boomer Life, Dr. Ron, and stick a pin in some popular myths. And
Yes.
I wonder if you can help me with a couple. Let me just run a couple of myths. This is the biggest one that I'm aware of when it comes to dental implants. Some people simply can't get dental implants. They don't have the proper, and I don't know if that's the right word, but they don't have sufficient bone density. They're just poor candidates. Next. Is that a myth, or can you put implants in anyone?
It's an improper generalization, Sterling. We can place implants in just about anybody who has sufficient bone volume and no disease process within that area that is capable of healing properly.
Okay.
And that can take some people out of the picture who are medically compromised even at a young age. And yet we can treat people in their 90s and I do so on a frequent basis, even late 80s, early 90s, where we put implants in and people get quite healthy. The bone density factor that you referred to, there are areas of the mouth and jaw structures where the density is low, but we can still place implants in there and get it healthy. It just requires a different knowledge set on how to graft bone into those areas and make sure they're stable, and how long it's going to take to leave them before you put a load on them. So bone density is a factor we consider, but not a contraindication to placing implants.
Now, you talked about wearing dentures and how over a prolonged period of time, wearing dentures can actually have a detrimental effect on bone structure in the mouth.
Yes.
So if you wear dentures forever and a day and suddenly out of the blue decide, I'm going to get some implants, have you kind of shot yourself in the foot?
You put a challenge there in front of the surgeon and the dentist, the restorative dentist as well, as to where to put the implants and how to do it. But we have protocols even for people with advanced bone loss. I have not found a person that we haven't been able to create a solution for. And it might be a little convoluted, particularly when all the great majority of bone has been lost. We might have to rebuild some of it. But even people with a great deal of bone loss, we can find the proper way to put implants in that will become predictably stable over a long period of time, even though they have so little bone structure.
Interesting stuff. How does the insurance industry look at dental implants, Dr. Zokol? Is it a cosmetic luxury that they're not interested in participating in, or is a lot of this stuff covered on extended medical and dental packages, benefit programs?
Yeah. They look at the implant dental world from a distance.
I'll bet they do.
Now, the thing is with dental insurance, it's not really insurance. It's a third-party payment system that contracts the recipient of the program to specific dental procedures, almost always excluding dental implants.
Oh, I see.
And that's the problem. It's not insurance. It's a third-party payment process.
Okay.
And they'll take a look at insurance and say, no, that's not in your policy. And some insurance companies will say, well, we could have put a bridge there. We'll pay you for the equivalent of a bridge on natural teeth.
Oh, I see.
And some will just walk away and say, we don't cover it.
So this is all part and parcel of being a new oncoming technology that is, however, reluctantly in some quarters being accepted generally.
I think that's true, but there's also that other factor. It's the cost of it. And we have never gotten into costs so far in our discussion.
Okay.
But if you take a look at dental insurance programs, or what they call insurance programs, these are very, very expensive for doing very little. And if you add implant dentistry into that process where it covers it, the premiums would just go through the roof.
Oh, I see. Okay.
And so financially, I couldn't see many employers taking out a policy which would include dental implants. It would drive their costs crazy high.
Okay.
And I think that's
because
a
the
great
employer
deterrent.
pays 50%, right?
Oh yeah, and that's a great deterrent. Is
Yeah.
that cost factor of putting that program together? If you were back about 20, 30 years ago, the BC government started to take on the concept of an insurance program for the geriatric population.
It was a Dentacare thing, wasn't
That's
it?
right.
Yeah.
And people who had dentures got free dentures,
Yeah.
and children. We broke that account so fast it was unbelievable.
Oh,
They
is
had
that
to
right?
abandon it. And Great Britain is the same way. And we take a look at the history of socialized dentistry in Great Britain, and it became more profitable for a dentist to take a tooth out than to repair it.
Mm-hmm.
The quality of dentistry in general went downhill so bad it was crazy. And that's not what our population is looking for. They want their dental health.
Right, and
you've
already spoken. The only thing you've talked about so far in terms of economic arguments is the fact that when you're face to face with a client after doing that all important assessment, after having been referred in the first place, you're going to crunch some numbers for this person, and you said earlier that basically it's, are we going to spend a whole lot of dough and fix this one tooth that may or may not last a couple of years? Or do we spend roughly the same amount of money on an implant that may last you the rest of your earthly days?
That's correct. That's absolutely correct. And our goal is our patient, not the tooth. The goal is our patient. So we have to factor in their ability to pay for it. How does it impact them? Because if you give a person a tooth and you've taken all the money out of their account and they can't afford to buy food.
Right.
I mean, what good have you done that person?
Right.
So it's a very large picture we look at. So we interview our patients. We try to understand what their goals are and see if once we've identified what we would like to do and what they'd like to have, we would like to help them figure out the way to make it, to finance it, give them options. Some people will have it available, others may not, and we'll see what we can do to help them
Okay,
achieve it.
need to take a quick break. I've got another myth for you in the hopper here. It's something called teeth in a day. I wanted to get you to tell us what that's all about. Our guest is our expert in dental solutions. Such a pleasure to have Dr. Ron Zokol back on the airwaves of AM 650. Zokol, ZOKOL.com is his website, but you may want to have a look at the new adventure, friends. It's BC Perio, BCPERIO.ca, and that's what well, we'll talk more about that too. This is Boomer Life, and we'll be right back here on AM 650.
It's all about the baby boomer lifestyle. Boomer Life on AM 650.